Podcast. I'm your host, Dr. Spencer Nadolsky, and we got one of our VIP patients, Carolin Tyler, here. She is going to talk about her experience through her weight struggles throughout life and what she's done about it. Welcome.
Thank you for having me.
Yeah, of course. We did a, was it TikTok? No, it was Instagram Live.
Yep.
They get all so confusing. TikToks, the Instagrams, the Facebooks,
Yes.
the Tweeters. We talked about a little bit of this before, but we're gonna dive into it. So, what's your origin story of like when do you remember struggling with weight and all that?
I think my weight became apparent to me at a pretty young age, probably around 7 or 8 is when family members, parents started saying you're bigger than your classmates or your friends, like we need to do something about it, essentially. It was around the time that my parents were also in the process of separating and divorcing. And so I started to notice just using food as kind of a way to escape all of those emotions and not having to feel those things. So it started really young and just progressively got worse over time with just the binging and being put on a variety of diets from a very young age and thinking that if I restrict as much as possible, then I'll lose weight and people around me will be happy and then I'll be happy. And it's kind of just that vicious cycle.
Did doctors ever say anything, or was this mostly from family members? Or
I know that my mom had told me that at 3 years old, a doctor told her that she needed to be monitoring more of what I was eating because I was a little heavier for my size. So I didn't know that until recently, but I think the first time a medical professional said something to me about my weight was when I was 10 years old. And I had just moved to Sweden with my mom, and I weighed 75 kilos is what I remember. And that was, she said like that, we need to do something about that. You're not in, you're heavier than what you should be.
Mm-hmm. And then, okay, so that was 10 years old. How long were you in Sweden for?
8 years. I graduated high school from there. My mom is Swedish. After my parents divorced, she moved back there with her family. So.
Okay, and then you came back.
Mm-hmm.
And what did they do? What are some of the things that they tried?
I think while I was in Sweden, the first thing we did was like have meetings with a nurse who, it was like a weekly thing with me and my mom. We would go and meet with this nurse and she would do a weight check-in and she would ask like what I was eating over the week and what exercise I had been doing, sort of kind of innocuous things like that. Like I wasn't yet put on or prescribed like you need to eat this, this, and this. But it was already becoming a huge focus. And I do remember going to the hospital where we were seeing this nurse was holding like meetings with dietitians. And I remember one meeting where the woman was showing like how much sugar was in regular soda and stuff like that. So there was an effort to try and educate about food. But I was 10 years old. I had no cognitive concept of like these things.
Yeah.
So.
Oh. Can you explain what you're feeling at the time? Was it like insatiable hunger, or did you feel like you mentioned the psychological components of like, I just want to ease the pain, or what can you explain?
I think at that point it was more so I just wanted to not feel anything, and using food as that emotional crutch and sort of my way of not having to feel all the things that I was feeling. And it wasn't until probably a few years later where I was much more into binging, where the insatiable hunger was, I was noticing that a lot more and feeling like no matter how much I ate, I couldn't not feel hungry.
Hmm.
And that was like, it's a really confusing feeling
Hmm.
because all of my friends, I mean, you think of Europe and Sweden in particular, everybody is very small, just genetically
Mm-hmm.
wise. And all of my friends were eating normally and they would stop when they were full. And I would be sitting there with food in front of me, like, I'm not full yet. Why am I not
Mm.
full yet? And, you just start to feel outside of yourself and outside of your friends, and kind of like, I'm not normal, I'm not a typical person, and what's wrong with me? And you internalize that shame and
Mm-hmm.
embarrassment, because if you're seen eating way more than your friends, people notice that, and they talk about that. And um, yeah, more so like my family would talk about it around me, or about me, about what I was eating and what I wasn't eating and things like that. My friends were just my friends, and I never really experienced any significant bullying or anything like that because of my weight or my size, which I am grateful for. So,
Well, that's good.
mhm.
Because yeah, you hear all sorts of things. So it sounds
Yeah.
like you had some good friends. You moved back. You went to college here then,
Yes.
and what, if any, help did you get when you came back? Did you look into medicines for the binging,
Um,
psychotherapy, anything?
I looked into psychotherapy. I did about a year with a psychologist doing cognitive behavioral therapy to try and my my first meeting with her, I just said, like, I want to lose weight, I want to be healthy, I don't know why I'm binging and eating all the time, how do I get to the bottom of this? And it was really helpful in terms of figuring out where sort of my feelings were with the childhood issues that I had growing up, having divorced parents, but nothing was able to really help pinpoint the binging and the restricting and all of that. That
Mm.
was, it just didn't feel like therapy was going to help that aspect of things. But I learned a lot about how to cope more with my feelings, and rather than, I knew that I couldn't be using food to not feel certain things or avoid emotions. But at that point, I think at 20, 21 years old, of having, 10 years of binging and restricting under my belt, like, it was far gone. It was too far gone past that point, if that makes sense.
Mm-hmm.
And my primary care doctor, I mean, every time I would see her, I do have hypothyroidism. I was diagnosed when I was 17 and put on Synthroid. Um, and so I had regular checkups because my levels were not regulated for a long time. So I was constantly having blood work done and constantly seeing my provider. And there was never any discussion about other options outside of just the regular diet and exercise. And I wish I had been referred to, a bariatric specific doctor or an obesity clinic or something. But I think at the time, primary care physicians, even now still, like, especially in rural areas, because that's where I was living, they had no awareness of that kind of thing. And
Mm-hmm.
even like medications were, I don't know, they just weren't talked about to me at all. Like, I had no idea what a GLP-1 medication was until I saw you talking about them last year. And the only real intervention that I had heard about was gastric bypass surgery
Mm.
or the vertical sleeve. And I had the gastric bypass done when I was 25. Um, but yeah, there was never anything said, which kind of breaks my heart looking back on, because I feel like were so many different points in my life where some kind of obesity treatment intervention could have led me down a different path. Um, and so that's why I think I'm so much more passionate about talking about all of the different ways that we can help treat obesity, because it's not just surgery, it's not just diet and exercise. Like we have these medications that can be less invasive than surgery or something, because I know I get messages all the time from people who aren't ready for a surgical intervention. I was at the time. I'm so sorry if you can hear my dog. She
No,
is
you're good.
digging. um, and you know, the idea of surgery is very scary for a lot of people. It's a huge adjustment.
Hmm.
And I think medications too, getting on a GLP-1 medication, there's a lot of lifestyle change that has to happen. It all works in tandem. You can't just take the medication and expect that you not do any work with it outside of it. Like it's not a magic solution to anything. Like you still have to be trying to make better choices for yourself. And I think these medications help you make those better choices. Um, so
Well, okay. Yeah, no, that's a lot. So let's
yeah,
back up to the
sorry.
surgery part. No, it's
Mhm.
totally good. Let's back up to the surgery. How did you think about that? Did somebody recommend it? You're like, I got to do something, and you're like looking into things. How did that happen?
I had heard, I'd known about surgery probably a few years prior, probably in my early 20s. I had surgery when I was 25. Um, my insurance at the time, on my family's insurance, didn't cover any weight loss surgery, any weight loss, anything, just wasn't on the plan. So I got my first big girl job out of college where I was able to get on my own insurance. And the first thing I did was call them and ask if any surgery was covered, mainly because at 25 years old, I had reached 401.6 pounds, and living life at that size was quite unbearable. I had just started a new job in a corporate setting, and I was struggling to walk around the office. I was struggling to sit in my office chair comfortably. I was struggling to um, function as a normal human being should in regular life. And I just knew that something has to happen, something has to change. And I did actually, because I moved to a totally different area several hours away from my family, and I needed a new doctor to help me with my hypothyroidism. And she was actually the very first physician who said, you know, there are things we can do. And she referred me to a bariatric
Hmm.
center. And she said, maybe not surgery, you don't have to do surgery immediately, but there are other things that they could help you with. And so that was the very first time at 24 years old where someone ever said anything to me about what my options were to treat my obesity. I just so happened to, at the time, believe that because of how heavy I was, that surgery was the best option for me to have the best success possible long term. So I did have gastric bypass surgery, and that changed the course of my life for the better. I lost 180 pounds, and then it was last year that I started on a GLP-1 medication, and I have lost another 30 pounds on that. So I've in total lost a little over 210 pounds.
That's impressive. And when you did the surgery, did you have any pre-op requirements? Did they make you do a
Yep,
program?
I had to have a meeting with a psychiatrist and do like psychological testing. I had to sit and take like a test that was 200. questions long or something. And he just sat me down and talked me through the process of like, how much sort of my life would change.
Hmm.
And sort of my background and with obesity and things like that. And he determined that I was psychologically a good candidate for surgery. And then I had to have several meetings with the in-house bariatric dietitian, which was really helpful to figure out how I would be eating for the rest of my life, prioritizing protein more, um, and sort of following those bariatric guidelines of not not drinking 30 minutes after eating a meal and keeping under those guidelines.
Okay, so you went through the process, got the surgery, you lost 180 pounds, which is amazing. So at the time that you're getting close, I mean, that's getting close to the 50% range. You're over 40% average of the total body weight loss. Amazing. And you had the bypass.
Mm-hmm.
Okay, not the sleeve. And then are you still taking the multivitamins and getting your levels checked and all that stuff?
Oh, yes.
Okay.
Yes.
Very good. Okay. Then there was a point though, you plateaued, right? Is that what happened?
Yes. After about, I would say 14 months post-op, I just kind of stopped losing. And I was able to maintain within a 10-pound range for like a year and a half, but I wasn't able to lose anything, and it wasn't easy staying in that maintenance range. It felt like I was having to fight my body every single day just to stay where I was. And I was trying to figure out if I was in a calorie deficit. Like I started to try to really diligently track everything, and I just I guess I wasn't in one, or I didn't know how, like, where I was going wrong with that sort of thing. And I had spoken to my bariatric dietitian at my surgery center, and there was very little guidance or help there. It was just kind of telling me, like, oh, just eat 3 meals a day and focus on protein and you'll be fine. And I was like, I know that. Like, in my brain, I know those things.
Yeah.
But it's also my brain is telling me that that is not satisfying me anymore. I can't, like, the insatiable hunger was coming back, and I didn't know how to handle that. So.
Okay. So then you saw one of my videos. I don't know which video it was. Shilling GLP-1s. I always joke about that because everybody's like, you must make so much money from Big Pharma. Like I actually purposely don't take money from Big Pharma because I know if I did, it's public knowledge. Like you can look it up, and I get all sorts of offers to do whatever, but I don't do it just for I don't know, the principle of somebody saying that, and I can say you can look it up.
Yeah.
But I do, these drugs are just like, I've never seen anything like it. It's just amazing. And, what am I doing? I'm basically just assessing whether somebody can safely do it. It's not like I designed these drugs or anything like that, but, if you've listened to this podcast, you've watched my videos in the past, like they change people's lives. So you saw one of my videos and said, what is that? So what went through your mind?
Yeah, I think it was actually a video. I don't know if it was specifically talking about GLP-1 medications or if it was talking about sequence on your program. And because I wasn't getting any real help from my bariatric surgery center. And so I was like, okay, well, if there's a telehealth way to speak to a provider who is specializing in obesity, and that is, that can help me more if there are other options like a medication, I think I should try that. And it was actually, so I had known about the program and I was kind of waffling, like, do I do this? I don't know if this is the right thing to do. And then Jamie Mills, the sleeve dietitian, came out last summer and said that she had started working with you and started taking a GLP-1 medication, and how even in the short time that she had been using it, how helpful it had been with sort of quieting her mind and getting the food noise under control. I was like, okay, I'm sold. Like, I
Mm-hmm.
signed up pretty immediately and was like, connected with a provider, and was prescribed a GLP-1 medication after going through some questions and things on sequence, and started taking the GLP-1 medication in September of last year. And I would say within a week, like, things were a complete 180 of how I had been feeling. And things were quiet again, and things felt much more manageable. And I was able to make decisions that served me in the best way without feeling like I was fighting to make those decisions.
Mm-hmm. Yeah, I mean, when I make these posts, I mean, people just argue all the time, and I'm just like, man, like, what about some other biological urge that you have that's relatively common? I always think like a mosquito bite, you just gotta
Mm-hmm.
scratch it. And so,
Yeah.
like, some people say, like, imagine staying up for a whole night and being really tired versus someone who didn't, and it's like you just want to go to sleep type of thing. And the same thing can happen with appetite. And what people don't understand is, like, we can talk about set points or whatever. There's a lot of debate around that, but like some people have higher hunger to where, like, okay, so just don't eat as much. Okay, it's easy. It's easier said than done, right? So
Definitely.
then when you try to cut down, the other issue is that your hunger levels go much higher than what they should be. At least that's the idea. And there's certain genetics things. So I have a feeling there's a genetic component when you discuss being 3 years old. You're not making choices. You're eating the food around you. You like, they talk about, there's certain syndromes out there, and you don't have this, but like there's certain syndromes, monogenic, obesity, mutations and things like that, to where, like, they talk about, like, kids, they have to lock cabinets, and kids will eat peanut butter and even flour and stuff like that. So, like, that's an extreme. But
Right.
they're clearly, for you being that young at 3 and having that, it's like there is a genetic component somewhere there, because psychologically you weren't at 3 years old not trying to um, ease the pain. It wasn't until later.
Right.
So it was likely both combined later. But and people just don't understand. They just live in their lives like, I don't know, I can do this. Why can't other people? Why can some people run faster? Like,
Mm-hmm.
why are some people just naturally smarter?
Yeah.
Or you know
Exactly.
what I mean? Like,
Yeah.
I don't know. So anyway, the amazing thing with these new tools, so we have surgery, which is the most powerful tool we have. These new drugs, although there's some new drugs that are coming in the pipeline that are starting to get to that level of weight loss. So then, why not use technology? We have cell phones, we have iPhones that can do pretty much anything that a supercomputer could do back in the 90s or early 2000s, or even 2010s or whatever.
Yeah.
We're utilizing technology, and that's the case here. Why not make your life easier? And so you got the surgery, and now utilizing one of these medicines. And, like, how does it, like, in terms of, I always ask people, it quieted the food noise, but what about, do you still enjoy eating?
I do. Yeah. I mean, I still have cravings. Like, it's not that I don't have any appetite, or I never want to eat, or I'm never hungry. Um no, I definitely feel hunger. It's just now that when I eat, I I feel fullness, and I'm able to stop. And I'm able to have a craving for, like, chocolate or something, and I'm able to have a piece or two of chocolate and say, "Oh, that was perfect. I
Yeah.
don't need to eat the whole candy bar, the whole bag of chocolate. Like, I'm good." And I don't ever want to be in a position where I am purposely trying to never feel hungry or never
Mm-hmm.
have an appetite, because I don't think that is a healthy way to go about
Mm-hmm.
things. We have, you know, people are meant to be hungry.
Mm-hmm.
It's just a matter of there should be a point where that hunger is satisfied and I stop eating
Yeah.
when I'm full.
You want to normalize it as opposed to uh,
Exactly.
like completely eliminate it.
Exactly.
That's a misnomer. I've seen some articles. Of course, there's articles all about these drugs. No, hunger is normal. We shouldn't be messing with it. It's like, well, it's not normal for everybody. If it were normal for everybody, we would all be similar sizes.
Mm-hmm.
And so it's like, that's why I make the little memes of like, people are like, you should lose weight. And you're like, okay, I'm trying. They're like, well, you need to try harder. Like, okay. And you finally use the medicine to help you. And they're like, well, don't do it like that. It's like, I can't do anything.
Exactly.
So, what are some things you want to tell people that are listening that are like, okay, like I'm on the fence. What would you say?
I would say to be realistic with yourself. I think with surgery and with these medications, people expect to lose weight super quick. And like, I've had people say, "Oh, I've been on this medication for a month and I've only lost 6 pounds." You've only lost 6 pounds? That's
Yeah.
6 less pounds than you've been able to
Mm-hmm.
lose before. Like, that's huge. And I feel like we get away from, for some reason, there's this idea that you have to lose all of your weight in like a month or two. And
Mm-hmm.
it's just the most unrealistic thing. And that's the most important thing I want people to know is like, this is going to take time, and it should take time. It
Mm-hmm.
should be slow. It should be 1 to 2 pounds a week, depending on who you are and your body composition and stuff. Like, it shouldn't be 10 pounds in 5 days. That's totally unsustainable and totally unrealistic. And you're going to lose muscle mass that you don't want to
Mm-hmm.
lose. And so I think just keeping a realistic mindset about it and not feeling like you have to lose X amount of weight in X amount of days. Like, to me, obesity is something I'm going to have to deal with for the rest of my life, even if now I am at a more typical normal weight. I still am going to have to utilize some kind of treatment in the longer term to keep things normal for myself. And also, that's another thing, like, people are concerned with having to take a GLP-1 medication for the long term. And I understand that concern, but there are so many other illnesses and diseases that people have longer term therapies for. And why should obesity be any different when it is classified as a chronic illness? And to just be prepared for that, like, and it's always a conversation that you can have with your personal, your own provider, and stay on a lower dosage. Or I think you've talked about having patients go longer in between doses.
Mm-hmm.
And there's always there are options that we have. And I think just keeping a level head about things, and
Yeah.
reaching out to people who are professionals and not following the quacks of the internet.
That would be ideal.
Yes.
That might drive me the most crazy. I get so
Yeah.
frustrated. So it's interesting about the expectation. So we've had a few episodes on hyper and hypo responders, and what's funny? I'm the original doctor at Sequence, so I was the one that saw everybody in the beginning, and now we're coming up on almost 2 years. I mean, it was like November or December of 2021, and I have a few patients who have been with us since the beginning, and they almost seemed like hypo responders. And now they're still steadily losing weight to where it's like, oh my God, it's almost been, usually in the studies, you see it, they plateau at around a year at the latest.
Mm-hmm.
But with us, I don't know what did it, so lessons, we're still like working on lifestyle. And for some people, it doesn't start clicking till later.
Yeah, absolutely.
And they're still losing. I mean, so that's actually incredible, thinking about it. So yeah, you may not lose that as much as your friend lost in that first month. it's all you just have to focus on yourself. I like what you said there. So
Definitely.
and some people, maybe the drugs and whatever won't work for you. It's as you said, it won't cure everybody, but very powerful tools. So
Definitely.
thanks for coming on. I love hearing
Thanks
your
for having
story. It's
me.
great.
Thank you.
For anybody listening, if this resonates with you or a friend or a family member you think it would help out, give it a share, and we'll see you next time.